Hi, I'm Sharon Handelman-Gottlieb, the CEO and one of the co-founders of Shela Health, and it's nice to be here. Shela Health is the precision women's health startup focusing on maternal health. What we have so far is developed modules for early prediction and precision-based recommendations for the leading pregnancy complications. So we're talking about preeclampsia, we're talking about preterm birth, we're talking about gestational diabetes, and more are in the pipeline. So a woman today can come at week 12, provide a very quick digital intake, and then have a risk score. According to that first risk score and triage, we basically tell the woman if she is at any risk for any of the complication, and if the case is yes, then we send her to the second step of our module to provide a specific and very unique multi-omics test.
Hello, I'm Dr. Avi Tzur. I'm a Chief Medical Officer and co-founder of Shela. At Sheba, I serve as the Director of Obstetrics and Gynecology at Sheba Beyond, as well as the Medical Director of ARC. Shela is in many ways a convergence of two dreams. My long-time dream to introduce maternal-fetal precision medicine, and Professor Yoram Luzon and Professor Omri Koren from Bar Ilan, a long-time dream to leverage their advanced machine learning and multi-omics tools to improve maternal health. Precision medicine has become, in other fields of medicine, the standard of care. In oncology, you don't treat lung cancer or breast cancer. You treat the specific molecular profile of the tumor. And our dream and our vision is to lead the same direction in maternal health and later in women's health in general. Currently, we are struggling to improve prediction of preeclampsia, of preterm birth, of fetal growth restriction and gestational diabetes. But in the end of the day, the idea is not to improve prediction. The idea is to improve precision. And that's what we're doing at Shela.
Today, if there are solutions to identify pregnancy complications, it's often tackled in a very siloed approach. And that's where Shela comes in a very different way. We see a woman as a holistic journey of her pregnancy. We want to provide her a comprehensive support and solution. So we'll tell her super early if she has any risk for one of the major pregnancy complications. And not only that, we'll support her through her journey to reduce the risk, to have that peace of mind that somebody is giving her a hand.
We developed a state-of-the-art machine learning model for predicting preeclampsia and to predict the potential response to low-dose aspirin among those at risk. So women will not only know if they need treatment, they will also know what treatment will help them prevent this prediction. Currently, the standard of care differs in various areas of the world. For instance, in the United States, prediction is based on clinical risk factors only, which means that many women at risk are not detected, and therefore preeclampsia is not prevented for these women. Furthermore, in those that are detected, many of them don't respond to low-dose aspirin, the current standard of care. So even if we do predict, we don't prevent. For me as an OBGYN, as a physician, many of my patients, I currently treat them based on the standard of care, risk factors, and one-size-fits-all low-dose aspirin. And unfortunately, some of them, of course, develop very early preeclampsia with related neonatal morbidity, and sometimes even more than that. And if we would be able to reduce the risk, that would be amazing.
The seed of Shela came out of the labs of Professor Yoram Luzon and Professor Omri Koren. And then there was an idea to merge the forces between Bar Ilan University in Israel and Sheba Hospital in a unique program which is called 949. 949 is the number of meters between Bar Ilan University and Sheba premises. And we're closing the gap between those 949 meters. So that's how it started, and the rest is basically history.